pet care info. So, Jim was telling me that you guys wanted to have more experience with cat handling, and I guess what's the best way to carry a cat? Do y'all know the best way to carry
In a carrier.
In the carrier or not in the carrier?
In the carrier, what's the best way to carry it?
Handle underneath.
Yeah. Do y'all carry them
Because
like
they
that?
break. And then you
They
gotta
can
wait.
break.
And so the cat's not rolling around.
Exactly. I was like, the most thing,
I was
just the
worried about
fear-free way of doing it is so they don't bounce them around in the carrier. So yeah, and if you need to get a cat out of the carrier and they don't want to come out, do you?
Madison, you are being recorded.
This Madison, don't listen to her. If they don't want to come out, what's the best way to get them out of there?
Take the top off.
Exactly. Yeah. Some people. Do you want to dump them out? Shake them out, dump them. No, that's not the fear-free way of doing it. Somehow, however, you do have to do that because the owners will wire tie the things together because they're all broken and stuff. So sometimes you do have. You don't want to shake them, but you just want to kind of tilt it and let them slide out. So don't viciously shake them like Madison would.
Sometimes we'll put like the whole carrier in the room with the door open,
Yeah.
and then let them kind of come out on their own and then pull it out.
If you could do that, yeah, for sure. Because I don't know, sometimes it might not be feasible depending on what you got going on in there, but ideally that's the best way to do it in pet care. Back here we don't have that option. The rooms we do, but half the time they won't come out anyway because we don't have the time to let them come out. But yeah, do you guys use the diffusers in the cat ward? That's what I thought. Do you ever use the spray too?
We don't.
Okay.
We should probably.
Yeah, so if you know they're coming, you can
Nicole's got
definitely.
the spray from us. She's used it.
Oh, she's used it sometimes?
Yeah, she's come over and got it from us.
Okay, but on a regular basis, I feel like if you guys have anybody that is checking in and gonna board, then go ahead and spray it like at least 10, 15 minutes before they get here. That way the pheromones are more fresh and they might calm down a bit. Also, if you have patients or pets that are really, really anxious and seem stressed out while they're here, it's not wrong to suggest to the clients to have like a PVP type situation the next time they come. And are y'all familiar with PVP pretty well? I know we got some newer people. Do y'all know what PVP stands for? Yes, no. Pre-visit protocol. So, pre-visit pharmaceuticals, sorry. So, it's medication to just try to decrease the anxiety prior to coming in. I know they know all about it on the Bourbon Sykes y'all have something coming there. But yes, so we want to make sure we do offer that option to clients if need be. If you notice that they seem like they're just really super duper stressed. So as far as handling goes, Jen told me you guys do nail trim sometimes for y'all do that, right? Okay. You guys do nail trim sometimes for kitties. So fear-free ways of doing it. A lot of people think the very first thing you have to do when you're restraining a cat is just grab it by the scruff. You don't have to do that all the time. Sometimes that will actually set a cat off. Like, that's just a trigger point for a lot of cats. So you want to make sure you're not scruffing the cats automatically. You can grab them, so just pretend like my fox here is a cat. And you want to have your pointer finger on the top of the head, thumb underneath one of the jaw bones, and then your ring finger or your middle finger, whichever one works, under the other side. So you want to kind of hold them in this position and then lay them on their side. That way you have full control over the head if they start trying to bite or anything like that. Also, if they start trying to bite, you can at least slide your hands real quick and grab the scruff too. So that's one good fear-free way of holding them, so you're not just automatically scruffing. And then you can just keep them on their side and hold the back feet with one finger between the two and wrapped around. So you can keep control of both back feet so they don't rabbit kick you while you're doing the nail trim. Additionally, if they don't like to be held like that, you can also do the burrito. So you want to take the towel and just kind of roll it up on the sides of them, and you can hold them like this as well. But the tricky part about that is you want to make sure that you have your thumb underneath their jaw, so that way they can't come down and bite. Some people don't feel comfortable with that because they can't feel exactly what they're doing, but that is one other method that you can use. Additionally, you can use a small towel in addition to this and just wrap it underneath their neck. You don't want that tight for sure, but just have like a little hand towel. That way you can have a buffer between your hand and their mouth. It's pretty much the only ways I could think to do that for nail trims. Any questions regarding anything I went over so far? No? Okay. Medications. Jen mentioned that you guys have to do like liquid medications or sometimes pills for cats too. So the best way to do that is just, if you have a decent cat, you can just let them sit down and just have your arm like on the side of them and hold their head back like this. And then you put your hands in front of them, the hand that has the medication, and you just gently open their mouth just a little bit and squirt just a small amount. You don't want to forcefully just shoot it in their mouth, because you can actually make them aspirate, or you can irritate the back of their throat depending on what the medication is, especially if you crush something with tablets. So just let them, just put a little bit in the middle of their mouth, let them lick it. And sometimes, more often than not, they'll just lick, depending on what it is. If it's like gabapentin or something, they'll probably foam or something like that. Same thing with pills. You want to hold them the same way, open their mouth and use the pill popper, and just make sure it's in the back of their throat and administer the medication that way. If they're not calm enough for you to do it like that, then take a towel and just completely wrap their body. So you just open the towel all the way and make sure their front feet are wrapped first. And then you just take the towel, wrap it all the way around this way, and then you have it underneath them as well. That way the feet are tucked and the head is the only thing out, and you don't have to worry about them thrashing around or fight their body or anything. I don't know if you guys can see that well. Just trying to lean so you can see. Okay, I think that's pretty much it for the restraint part of that. Any questions or any additional things that you guys can think of as far as handling physically?
I do. I know when you work on a scene for like blood draws, you could also do like a
Mm-hmm.
and then like
You're talking about for blood draws?
Yeah.
Oh, okay. Well, this is for
cats?
like pet care stuff.
Oh, okay.
Yeah, 'cause they don't have to
So,
do it. Yes, but we do that. Yeah.
But
Perfect.
just like
yeah.
this, you can go over maybe like just cat restraint, like
Yeah.
one person holding and then another person just doing.
For
maybe
anything?
just like maybe like
ear cleaning or something like that.
or like a
So you could
flea
do the same-
medication.
Yeah. So flea medication, same thing. You can actually use a towel that way too, but you just have to make sure you have your towel loose enough to move it back, because you want to make sure you get it at the base of the scalp and not just dripping it onto the towel. So you can do the same thing with towel method, or you can just like kind of sandwich them between your arms gently like this and hold like this. That way your fingers are not around, because dogs you would do this with. Cats you won't. You want to keep your hands under their jaw and then your thumbs behind the head. That way if they go to try to bite, at least they're just going down towards the towel or the table. But yeah, that way you'll have access to put the medication wherever you need to. So that's two methods, because if you do it like this, then you won't be able to get to where you need to for the medication. So that's topical medication. But if you're doing something like an ear cleaning or something, this will give you more head restraint too, if you want to hold like this with the 3 fingers. Or same thing here, you can do it like this. But you want to make sure if you have your hands around the front of a cat's neck, you are not squeezing, because you can definitely cut off their air supply. You don't want to do that. But just make sure you have like gentle control, basically. That's the main thing as far as fear-free goes, is just making sure you have gentle control of the patient the whole time. So that's with cats. You don't really have to do a whole lot of restraint unless they're super wiggly, and that's the best way. Cats just like to kind of be close to you, so you can have them like up against your body. If they're on the table, just pretend like this is a table. You can just kind of hold them this way, and then you can do whatever you need to sometimes if they're well behaved. But if they're super wiggly, of course, you can use a towel or just have them sandwiched between your arms. So that's the best fear-free way. And if all else fails and you absolutely have to scrub it, then you just have to. But we try not to. Some people still do it right off, and it's just habit. But you just try to be more fear-free and not do that is the ideal thing to do. Anything else? Okay. What's up?
Does scruffing like stress them out more?
It can. Some cats it actually subdues. Like there are some cats that it's like they have that kitten like reflex still, where if their mama picks them up by the scruff, they just kind of relax. Some cats still do that as adults, but most adult cats don't like it. But there are some that it will make them. They may not like it, but at least it will. It's like it's a more gentle control method than actually like pinning them down or something, because you can gently scruff them and then they're just like, all right, I'll be still. But some cats, like you scruff them and it sets them off completely, like they will try to eat you. But if you don't scruff them, you can get a lot more done. So it just depends on the cat. Everybody's different. Yeah. So it can stress them out, but not always. Anything else? Keep it in, that. Keep it in.
I did.
You
And
learning?
then,
Are you learning?
I mean,
We're
this
just talking about
doesn't
Madison's
this doesn't
horrible
apply
cat.
to mine, so but yes,
this does not apply to all cats.
Yeah.
Some cats require
heavy sedation.
heavy sedation, full anesthesia type thing. Let's see. Oh, so client care, like fear-free client care. When you guys talk to the clients, do you try to make sure you use words that don't freak them out? Like, what do you say as far as the housing goes? Do you ever use the word cage or anything like that? You don't ever say cage to
Condo.
clients? Condo. Okay.
Suite.
Room. Okay. Suite. Condo. Okay. Okay. So yeah, just try to keep the verbiage fear-free too when you're talking to clients. And I guess I can kind of
You
tie
say
that
cat
in with
ward,
y'all
I
too.
don't like
Yeah, cat ward or
And we don't say we're taking them to the back. We say
Yes.
we're taking them to treatment.
treatment area. Yes, yes. Don't say the back because everybody thinks it's a dungeon back there. Some torture goes on. Or
I
something.
mean-
I don't know what it is about that word, but it sets people off. Right? And as far as PvP goes, how do you guys word that
In
when
what
you're
sense?
talking? Like when you're talking to the clients,
Like
what
if
do
we're
you
reminding
use?
them?
Huh?
If we're reminding them they need it?
No, like if you're noticing that somebody's super stressed and if you're recommending, because I know sometimes y'all will do that too. It's like, well, maybe they'll
If
benefit
you know
from
that your
this.
cat's like really stressed out, we have medication that you can give pre-visit that will help.
Okay.
So they're not so stressed when they go home or come back.
Okay, you just say medication.
Yeah.
What about when you guys are dealing with the appointments that require sedation? Same thing with y'all, like the grooming, sedated grooms. What words do you guys use as far as that stuff goes?
Like when we're booking it, sometimes I'll just say, oh, looks like so-and-so gets a little stressed when they come here, and that we do a little bit of sedation just to help calm them down.
We
Mhm.
don't say boss.
Yeah.
Okay.
With us, we do, but not with them.
Oh, yeah. Do y'all, what kind of verbiage do you guys use for the grooming clients that require sedation? You know, they just know what they're coming in for, and it's not really a discussion. Do you ever have ones that you think would benefit from it, and it's like, hey, maybe you should do this?
Oh yeah, I've definitely talked to clients before about like, hey, maybe we should talk to them about upping the meds a little bit.
Okay.
Just see if there's some skills we can try.
And do you word it as such, like you're just doing it for the benefit of them, the
Oh,
patient?
I'm like, it'll be safer for them, safer for us, it'll be safer for
Okay.
everybody. I won't be stressed out.
Yeah. Okay, cool. Yeah, so I think just making sure that we use fear-free verbiage is important too, because sometimes saying the wrong thing, like you could say the word, like, for
Your
an
dog's
example, the
aggressive
back.
here.
Huh?
If you say your dog's aggressive,
Yeah,
tries to
yeah.
bite everybody.
Yes, we try not to say that they're being really aggressive. It's just like they're really stressed. Because essentially that's what it boils down to. They're
I have one client
Like
who'll come in and every time he picks up, he's like, still got 10 fingers? I'm like,
Oh.
yep, still got
oh
them.
my God.
At least he's
That's
checking.
terrible.
Way great.
People. Now, body language. That was the other thing I wanted to discuss. Now, do you guys know the proper way to greet a cat? Sit on the floor. Anybody? Any other input?
Don't do a lot of good.
What's that, get on their level? Okay.
Have them smell your finger
Don't stare at them.
Don't stare at them, that's right.
if they're nice.
Big
Soft-
Jedi.
soft eyes. Yeah, soft eyes. Do you, when you
Alpha.
approach a cat for the first time, do you just walk right up to them? Like, what do you guys typically do when you are approaching a cat for the first time? Like, if they're staying and boarding, how do you guys address them? Mm-hmm. Okay.
It's always a slow, soft approach.
Yes.
Soft voice.
Yeah.
Not
Yeah.
being super invasive going directly
Mhm.
to the cat. Just
Exactly.
Slow, kind of
Perfect.
side.
yet. Yeah. So those are all good pointers for sure. Now, the other thing is just if you have a cat that may be super fearful and acting aggressively, you definitely, I feel like people are more apprehensive to trying to reach in and do anything. So naturally, you're probably kind of like jerky with the movements. You want to try to not do that too, because that freaks cats out more. Because if they see somebody reaching in there and they're just constantly like okay, apprehensive like that, then it will completely just rock them sometimes. So you just want to kind of make slow, deliberate movements. Even if you are being cautious, just make sure you're still just like slowly going in there and just kind of like trying to grab the cat or do whatever you got to do around. But just try not to be too twitchy with your movements, because that'll set them off
Certain,
sometimes.
I don't know, just behavior that like you're like absolutely do not approach or even try.
So that's the other thing, body language for cats. So unfortunately, the way this afternoon went, I didn't get to print everything I wanted to, but I'll have those to y'all later. Do you guys know what signs show that a cat is stressed out?
Fluffy tail?
Hissing, fluffy tail, fast twitching, arched back.
Their ears go down.
Yeah. Yeah. Oh, you said ears. I heard somebody say ears over here, I thought. But anything else that you guys can think of that signal a cat stressed out?
Dilated people.
Actively trying to eat.
Yes. I was like, yes.
Actively trying.
Well, that's pretty obvious, man. But subtle things are like the ear position, the eye, the pupil dilation. So,
Will of Roll.
Tail side?
yes,
Like,
yep, that's what Paige just said. Yep, as long as like, if they're so if they're just like a swooshing slowly and it's just like a fluid type thing, but if they're like fast twitching and it's like really short, fast twitching, that is a usual subtle sign that they are becoming agitated to some degree.
Willa goes
But-
down on her side. Like,
Oh, yeah.
she goes like this, but she wants all four paws up.
Yeah, like that's a submissive thing.
Yeah, she believe it or
But
not,
they're
she's actually a lot
not.
of fear, so she.
Yeah, that's what I was like. But when they
She's
get in that
agitated.
mode, they will attack too, because
Yeah.
it's like they don't like being cats don't like being submissive.
No.
So I mean, no pet really does, but cats are worse about it. So when they hit that mode, then definitely use caution if they ever just lay on their back, because you're liable to be really attacked really badly if you touch them. But basically, if you see their ears are pinned down, pupils are dilated, they have this crouched position, if their tail is like wrapped tightly to their body, then they're probably on guard and possibly going to attack you. Now, as far as completely don't touch, is if you see all the red flags, the ears down, panting, hissing, growling, swatting, that kind of thing, that you want to just kind of have someone with more experience try to grab the cat if you have to get them out. If you're trying to get them back in their carrier or something, most of the time you can just open the door to the carrier and just put it like in their face, and they'll just hop in there because they don't want you bothering them. Sometimes that does not happen. So if you have a cat that seems like they are flat out aggressive like that, then definitely grab someone like one of the nurses or something to see if we can try to help out. But you can always use towels, cat gloves. If they're that irate and dangerous, we do have a net that we can use for them too, which is not ideal, but sometimes you have to use that for cats. So just a pin.
Or if they're picking up, you can grab the owner.
Sorry, she's already walking that way now. I was just like, wait, who's that?
Yeah, we would grab.
Sorry, yes, and if the owner's here, definitely just go ahead and grab them. Yeah, that's what we do back here too. It's just like you can go ahead and help us out with that. So yeah, body language, client care. Okay, cool. So that's pretty much it for the pet care portion. The CSR stuff we went over before, but I can reiterate some stuff as well. How much longer?
Keep going.
Okay. Before I bounce this way, do you guys have any questions about anything? Okay. So CSRs. You guys know the best ways to try to mitigate and stress out here, basically.
And this is pet care CSRs too.
Yeah. But
Yeah, especially if you have a BP check or like you can hear them in a cage, or if someone brings them in and they're not in a carrier,
yeah.
you put them in a room.
Yeah. Now, do you guys ever interact with the medical side as far as like if you see someone from the medical side super stressed, you ever just alert anybody? Just kind of,
If it's like super duper quick, especially if they're over here.
Yeah.
But usually they're pretty quick about getting it.
yeah, yeah. Okay, okay. And you guys, y'all typically run into anything like that? Because your check-in is pretty fast if people are waiting in the car. Yeah.
So we've never had anyone bring a cat in and out.
Okay. Okay. That's good. That's good. That happens all the time. Okay. I know, right? But yes, so you guys know to get them in a room immediately. Cats. I feel like, honestly, the fear-free method is if you can get a cat in a room immediately, just go right ahead. If anybody is out here, even if they're excited and barking, like they're happy trying to greet everybody, it's ideal to put them in a room too, because the noise level out here can stress out patients.
And us.
Yeah, that's what I was gonna say. It'll increase the FAS in everyone, including the humans. 'Cause, I mean, it reverbs so much out here. It's ridiculous.
It's the acoustics.
It's terrible.
We know.
But even my voice, I can hear it bouncing off the walls. But seriously, like, just try to get the loud ones in there. And sometimes it's just temporarily loud because y'all have very excited ones going to daycare and things. So, I mean, it's just temporary, so it's not long-lived out here. But if they're going to be waiting for an appointment, then definitely go ahead and get them in a room. And you guys are good about that anyway. Birds, 100%. Always go in a room. Rabbits should always go in a room. Like any exotic, snakes too. Like anything that could be a prey to a dog or cat needs to just go straight into a room because it just completely stresses them out. Even if they don't seem like it, some cats will just be in their carrier quiet. But cats are good about internalizing stress and then just lashing out of nowhere. So definitely want to make sure if you have any exotic birds, reptiles, rabbits, hamsters, that kind of stuff, just go ahead and put them straight in a room if possible. And if not, then try to have them like just wait way away from everybody else, just in the corner kind of deal. Do you guys try to enforce the cat dog side thing? I know it's kind of
Honestly, it's more
Hard.
like dogs that need to be left alone, can't be near the front, and then like the ones that are friendly. It's kind of what it turns into.
got it. Okay,
Especially in the morning.
Like the ones that are reactive,
gotcha.
that I want them on the side where I can't see them and they can't see anyone's back.
Got it.
Or
Okay.
if they got those retractable leashes, that aren't real leashes.
Yes.
Yeah, those.
And what about pheromones? Do y'all use?
We used to feel away.
You still do? What about the DAT tool? Do we have that
We
anymore?
have it.
We have it, but we don't use that as much.
Okay. We should probably, if you notice a dog seems nervous, then just give them one. Just offer it at least. And a lot of times clients are like, oh no, they're fine. But
When
you know,
there's
you could
four
at
of
least
us,
offer them.
we're able to like pop up.
Exactly. Yeah.
What do you give them?
And you don't have
We
to
can
get up
spray
and
it
put it
down.
on them. Just say, here, you can put this on them.
I
It's got
say
a-
feel away on a bandana and I'll have the owner stick it in there, but like
Yeah.
just when there's enough of us.
Yeah. And you can always just have the owner do it. Just say, hey, this is to help calm them down, and spray it and hand it to them. And even if they don't put it on them, at least if it's by them, it still helps, even if the owner's just holding it. And you guys are good about having friendly faces, calm voices, all that stuff, treats. What's up?
Just if y'all want to transition to talking about infections and how to recognize them.
Okay.
As long as you
Okay. All right, just a couple more points and then I'm done. Let's see, scheduling, we talked about that. Oh, happy visits. Do you guys ever recommend happy visits?
I know if we haven't recommended them, but like the doctors have
Yeah.
for like Blue Martin and then they've done happy visits on here for daycare. Those are the only two off the top of my head that I know of usually.
Okay. Now, happy visits are something that we should probably do more of, especially if we have, and the medical team, the nurses and doctors should be the ones initiating that. But if you guys notice they're just like, oh, they're just so stressed coming in when you're talking to them on the phone, just mention it. Hey, there's happy visits, there's no charge for it. And if they're super nervous about coming in here, they can just conduct it outside for a little bit. I've got this little handout where they can do a scavenger hunt here just to try to help them keep their mind focused on something else other than being here. I saw something else that they can actually do that for boarding too. Like they can just come be here for one night versus leaving them for an entire week if they've never left before. So that's another thing. Okay.
Where it's like a lot of people think evaluation days are like, oh, I bring them for the day and try it out. We don't see clients right now for here. But I always say it's better just to do an overnight stay to see how they actually do eating.
Yeah, exactly. Got it. Okay, so y'all do the trial stays already. Cool. Okay. All right. So I know we talked about noise control, wait times is another thing. So I know y'all are good about repeating things to the nurses too. So we try to minimize the wait time. Pheromones and smells. So that's another thing. We went over pheromones, but smells, like we try to make sure we clean up any messes immediately and thoroughly, because that can stress an animal out too, because their pheromones are left behind and can stress another dog just walking in the door. So, of course, cleanliness is best out here. I think that's pretty much it. Because you guys, we already went over this fear-free thing. The only thing I was thinking with the lobby, I know we talked about this before. If we can try to figure out a way to try to make the lobby more fear-free and try to enforce the cat-dog side to see if that helps kind of decrease stress for everybody. It's just gonna be a tag team effort. Y'all can just give input, and y'all can too if you want. But I know they're the ones sitting here looking at the lobby for the medical side all the time. And if you guys can have any input too, anybody can.
I know when I did the fear-free certification, it was about like the scale, like to make that more fear-free, like having treats and peanut butter over there. or something like that.
Yeah.
Peanut butter maybe not, because I know people have peanut allergies, but treats.
Okay, so treats love scale. Yeah, we can definitely do that.
So is it cats over there? and
Cats
dogs
over
outside?
there generally.
The problem
What about
is
the
it's
dogs
just
that need to get
there's
weighed?
not much
There's not
to
enough
it.
chairs. Yeah, but that's what I was trying to figure out. Like, how can we just like?
But that's the thing too. I mean, it's just when they're dogs that are reactive. I mean, if we can't, because there's many afternoons we don't have any room.
Yeah,
So it's like we can't have. It's just a mess.
I get you.
Time.
Yeah.
It's
And
hard.
It's hard too if someone's sitting here for medical and then all the daycares are going
Exactly.
past.
That's why I was like, I feel like that's just a terrible spot for chairs. Like,
We do it when we can,
yeah,
but
yeah. But that's why I was kind of brainstorming.
Yeah.
Yeah.
We can move these chairs
That's what
down a
shift
little
things
bit.
down. Yeah, but I was like,
yeah.
then that thing. We'll figure it out.
Yeah.
But that's just a tag team effort. We'll figure it out. But yeah, you're good. All right. Thanks, guys. And then I'll give you guys a little more information as far as like cat body language and stuff like that. And then the people that didn't fill it out, I'll give you guys a sheet to just determine more fear-free aspects of the hospital in general. But Dr. Beatty's going to cover ear stress.